Good morning. How are you, doctor?
Good, thank you.
Would you please tell the ladies and gentlemen of the jury your name?
Vidya Krishnamurthy.
Okay.
Okay, time out just a moment. Pull that microphone down right there and slide your chair up, if you don't mind, as close as you can get to it. It's hard to hear in here, or it is for me. It's hard to hear unless you get close to the microphone.
Vidya Krishnamurthy,
Okay. And how are you employed, ma'am?
self-employed.
Okay. In what profession? What do you do?
I'm a pediatrician and a clinical geneticist.
Okay. And I want to go through your background just for the benefit of the folks on the jury. You have graduated from college, is that correct?
Yes, sir.
And where did you graduate from college?
Medical college from India.
Okay. And did you practice medicine in India?
No.
Did you practice medicine in another country?
Yes, from Malaysia.
Malaysia. Okay. And how long did you practice medicine in Malaysia?
12 years.
Okay. And while you were practicing, in what field? Was it pediatrics?
First, in Malaysia, we work for the Ministry of Health for 3 years. We have to. Then they allow us to specialize. Then I specialized in pediatrics and worked as a pediatrician.
Okay. And were you board certified while you were practicing in Malaysia?
Yes, from UK.
Okay, from the United Kingdom.
Yes.
Okay. And obviously now you're in the United States. How long have you been in the United States?
Since 1999.
Okay. And have you practiced medicine in the United States since 1999?
No, in 1999 when I came, I had to do my board exams and then undergo training again here.
Okay. And when did you sit for board exams here in the United States?
1999 I came here, 2000, around 2003, 2002, 2003.
Okay.
Pediatric boards.
Okay. And I presume that you passed those boards?
Yes.
And have you practiced as a pediatrician in the United States since then?
Well, 2003 to 2005, I did genetics at Duke University. Then after that, I started practicing.
Okay. All right. When you say that you did genetics at Duke University.
As a resident.
Okay. And how long were you there?
2 years.
Okay. And after that, what have you done?
After that, I was in private practice with Sugarloaf Pediatrics in Lawrenceville for a year. And then because I wanted to continue my genetics career, I had to become self-employed because it takes too much time to see a genetics patient and the pediatric practice couldn't accommodate me.
Okay. And where is your office or your practice currently located?
Alpharetta, Georgia.
And are you licensed to practice medicine in the state of Georgia?
Yes.
All right. In terms of becoming a geneticist, what sort of specific training have you undergone in that field?
Well, for first you do either a family practice or some other residency. In my case, it was pediatrics. Then the 2 years that we are there, we do both inpatient and outpatient. Once a week, we see patients in the outpatient clinic. I assist the geneticist and the genetic counselors. I would go in and take the history first, do the examination, then come back to the back room and discuss with my attending as to what I think the case is. Then she would direct us further to do further testing. Then after that, in the afternoons, I would go into the hospital and do the ward rounds, and I would go and look at consults. Like they would send us to various different floors to say patients who have to be seen. And then I would go see the patients, write the consult, come back and discuss with my boss again.
Okay. And was that at Duke?
Yes.
Okay. And that was for 2 years?
Yes.
All right. And what is the name of your practice?
Pediatrics and genetics.
Okay. All right. Judge, at this time, I would tender Dr. Krishnamurthy as an expert in both pediatrics and in genetics.
Ms. Bernard, any objection?
No, Your Honor.
Ms. Fox?
No.
She'll be admitted for that purpose.
Okay. Dr. Krishnamurthy, you have a patient by the name of Jamison Timms.
Yes.
And do you recall when you first encountered Jamison Timms?
Yes, it was in February of 2022. 2022 when he was about 4 months of age.
Okay. And what were the circumstances, to your knowledge, of Jamison coming into your
There were
office?
concerns for a skeletal tissue problem. There were concerns for child abuse.
Okay. And on your first encounter with Jamison, what happened during that visit?
I took family history. I examined the patient. Then I looked at the previous test results. Then I ordered further testing.
Okay. And in terms of genetics, was there anything out of the ordinary in terms of what you had been provided in Jameson's record?
From the previous
Yes.
history, he had history of rib fractures. He had history of compression fracture of the spine. There were some bruises that was noted at a previous hospital that raised concerns for non-accidental injury. And then when I examined him clinically, he had light blue sclera, he had soft doughy skin.
Okay. Did you receive, had there been any genetic testing done at that point in February when he came to
It was
you?
a previous genetic test result.
Okay. Was there anything out of the ordinary in terms of that result?
There were 2 mutations they found, one in the COL1A2 gene, the other one was SP7. The SP7, they said it's likely tolerated. The COL1A2 gene, they were uncertain with it was a variant of uncertain significance. So the lab couldn't tell us yes or no, whether it's going to cause a problem.
Okay. So when a patient comes into your office, such as Jameson, do you do any type of physical, any physical examination of the
Yes.
child? And did you do that when he came into your office, that first
Yes.
visit? And what, if anything, did you notice?
I noticed he had light blue sclera and soft doughy skin. And I don't know if I'm allowed to, I can look at the chart to see what else I found in him.
Okay. Well, let me stop you there. Do those, and we'll get to why a little bit later, but just right off, do those raise any concerns or red flags?
Given with the past history of the previous genetic testing, there are concerns for connective tissue disorder.
Okay. And what is a connective tissue disorder?
The connective tissue, I like to describe it to my patients as like the Lego building block of your skin, your joints, your eyes, the walls of your blood vessels, and your skeleton. And it's like you build a scaffolding for a building, it has to be strong. And if it is not strong, there's a spelling mistake. So the scaffolding is not so strong, you can have problems with the skin, joints, eyes, blood vessels.
After February of 2022, do you know when the next time is that you saw Jameson?
May.
Okay. May of 2022?
I would have to look at
You
the
can look,
chart.
that's fine.
Can I look?
Yeah, you can.
Okay. 2024. 5/29/2024.
And was that, again, at your office in Alpharetta?
Yes.
How did Jameson, if you know, how did he arrive to the visit?
He came with his family.
Do you recall who in his family was with him?
Grandparents, parents.
And what do your records indicate? Did you do a physical examination of Jameson
Yes.
on that May visit?
Yes.
What do your records indicate were issues?
Am I allowed to look?
You can't read from it, but you can
okay.
look at it
Okay.
if you need to look at it to refresh your
Blue
recollection.
sclera. Blue sclera. Yeah.
And do you remember how old Jameson was at that visit?
I'd say about 2 years plus.
Okay, all right. And what Or was there any workup or anything done as a result of that visit in May of 2024?
We reanalyzed the test results at GeneDx.
Okay, and when you say the test results, what test results are you referring to?
When he came in 2022, I had ordered testing at GeneDx. It's a genetic lab, and we got the first test results. Then typically when I see patients several months to a year later, the lab will reanalyze the test results for us for free one time, which I asked them to do.
And so did you receive anything else from the lab regarding those test results?
Yes, when they reanalyzed, other than the COL1A2 gene, they found he had a deletion. He's missing a small piece of chromosome on the long arm of chromosome number 15.
Okay. Do you know when your next visit with Jameson was?
I think August 2024.
Okay. And do you know what the purpose of that visit was?
A follow-up visit to discuss how he's doing.
Okay. And was there an examination done of him on that day?
He has blue sclera.
Okay. Let me ask you for a second about the variant at COL1A2. It has been described in this court as a variant of unknown or uncertain significance. Are you familiar with that term?
Yes.
What does that term mean to you?
It means the lab cannot definitively tell us whether this gene change is going to cause a problem or not. And so typically what I tell patients is follow up with us in a 6-month period to a year to 2 years. In one patient's case, it was 5 years before the lab came back and told us the final result.
And how is that result obtained?
They reanalyze that. They look at the genes and the data, and then they look at the database, and they see if there are more patients who came up with the same mutation, what are the clinical features they have, and then they go from there.
Has there been genetic testing done on any relatives of Jameson?
Yes.
And who has been tested?
Whenever we find a change in the child, we always go first to the parents, tested both parents. In this case, father carries the same gene change. Father also has the deletion on the long arm of chromosome number 15. And then mother didn't have it. Then I obtained further history from the father's side of the family. And I tested a paternal grandfather. He also carries the same gene change. The reason I tested was there is history of hearing loss on that side of the family.
What does that tell you potentially?
Well, sometimes in connective tissue disorders, you can have hearing loss. May not be apparent at birth. It starts from teenagehood to adulthood. And the paternal grandfather told me he had hearing loss from teenagehood. And he said his father also had. The paternal great-grandfather for Jameson also had hearing loss.
Were there any other health issues on the father's side of the family?
Yes. Father, when he was a young adult, he had fractured several bones. And then on the father's side of the family, the father has several paternal uncles who had accidents, who had fractures. And on the grandfather's side of the family, the father's father, he recalls that too.
Are you familiar with the genetic disorder constellation of issues called osteogenesis imperfecta?
Yes.
And what is that?
It is again where the genes can either be COL1A1 or COL1A2. Majority of the patients have a mistake in the COL1A1 where they don't produce enough of the normal collagen. The collagen is like a braid. It's a helix, triple braids. And in the triple braids, to keep the scaffolding very stable, you have glycine bridges, so-called. And so majority of the patients don't produce enough of it. But the other part is COL1A2 where they make abnormal protein. And so in this disorder, the children are at risk for, they can have things like blue sclera, they can have history of fractures, and sometimes the fractures can occur with no trauma or very minimal trauma. For example, in the newborn period, you change the diaper of the baby, that can happen. And then it'll decrease after the early childhood period, then kind of normalize, then again it'll start up again when they become more active. And then in the older people, as they get older, ladies, for example, towards menopause, they will fracture again. But there's a great deal of variability even within the same family.
Have you had any, in your practice, any personal experience with kids, children that have that wide degree of variability?
Yes, I have a family of 5. They all, most except for one child, most of them carry the same mutation. The father was much more severe. The children fractured. Some children fracture, some children don't fracture. So it's very difficult to say. And this is known as interfamilial variability. Why this happens, we are not sure.
Can an individual who has a connective tissue disorder, can it change? Can the symptoms change within that individual over time?
Yes, like I said, in the infancy period, they might be fracturing, and then it dies down, then it starts up again when the child starts to become more active.
And you have seen that in your practice?
Yes.
Have you met with Jameson and his family since August of 2024?
I can't remember. I have to check. I think 3 times.
Okay.
Yeah.
Based upon your meetings and your examination of Jameson, your review of his history, your review of the genetic testing that's been done, have you made a diagnosis of this young man?
Based on the family history of hearing loss, the family history of fractures on the paternal side of the family, and then his clinical features, he presented with soft blue sclera, he had fractures in the neonatal period. It is suspicious for a connective tissue disorder, but we will have to wait and follow up with the lab. It is my understanding that we will need to do further research on this gene. We're beginning to learn a lot more about these genes, and then in the future we will have better answers.
Okay. Thank you, ma'am. That's all I have for you right now. The other attorneys will have some questions for you.
Ms. Fox?
Good morning. First of all, thank you for talking to me last week. That was very helpful, and I appreciate your time in that regard. You had told me that during the first visit, you were able to get a pregnancy history in this case. And that pregnancy history was that Jameson had a normal birth.
Yes.
And he was born vaginally, and
Yes.
the pregnancy itself was uneventful.
Yes.
That was information provided to you from the family?
Yes.
And then also at that time, something that was concerning to you and you asked about is whether or not Jameson had met the normal milestones.
Can I look at the chart?
Absolutely.
I can't remember so much. Yes, at that time he was only 4 months old, yes.
And that was important to you genetically because if he was not meeting those milestones, you would have to look at other things for potential causes, correct?
Yes.
Okay. In addition, you were provided a number of medical documents
Yes.
to begin your case.
Yes.
And part of that included the 3-panel test genetically that was ordered by CHOA?
I think it was the invitators that
Okay.
you are mentioning, yes.
And as part of that, it did initially note the variant on the COL1A2 gene. And you spent a good bit of time researching it and talking to different professionals to make a determination as to whether or
Yes.
not it would be an issue in this case.
Yes.
And as you already told the jury, the most common diagnosis for osteogenesis imperfecta is the COL1A1 gene.
Yes.
That was not an issue with Jameson.
No.
The only variant he had was in the COL1A2 gene that would have been a potential issue in this case.
Yeah, yes, possibly, yes.
So after you did your research, after you made your phone calls, and after you did your initial analysis, it was your determination that the variant in the COL1A2 gene was not the cause of the breaks, and you needed to do further research. Isn't
Yes.
that correct?
Not, it's
In-
very difficult to say because this is a variant of uncertain significance. So I don't know if I can mention who are the people I called or what research
You
I
can
did.
certainly mention all the people you called, but you're not allowed to say what they said. So you talked to Dr. Peter Byers.
Yes.
He is the renowned expert in the field in the United States and also in charge of the lab that did the test.
Yes.
You talked to, or you read the different records that were involved and the sub-studies regarding those records.
Yes.
And as you made a determination, the determination was that it was very unlikely to cause a problem clinically.
In my research, I don't know if I can say discussion, but in my research, I decided to do further investigation on this gene on the paternal side of the family. Because this is a variant of unknown significance, we have to test where the gene came from and go up the line as far as we can and see what symptoms they had.
Okay. Well, one of the symptoms that you've pointed to was hearing loss.
Yes.
Did you know that the family lived and operated around a drag strip in our county?
No.
Did you know that the drag strip can be heard from miles away?
I don't know what a drag strip is.
Race car drag strips.
Oh, okay.
Very loud noises all the time, consistently. There could be environmental factors that cause hearing loss, such as living by a very large drag strip that makes noise all over the county.
Yes.
Yeah. So, but at any rate, the bottom line on the analysis on the original reports was that it was very unlikely to cause a problem clinically, correct?
Am I allowed to read it out?
I'm sorry?
Can I read it out? No.
You can't read from it. You can use it to refresh your recollection, though.
Okay. It is a variant of uncertain significance and unsure whether it can cause a problem or not, basically.
Unsure.
Unsure.
Okay. You also did the genetic testing on the parents.
Yes.
And specifically as to Carrie Timms, you found that she did not have any genetic anomalies.
Only for the gene change that we tested.
Okay?
Yeah.
So she didn't have COL1A2 in her system?
COL1A2, no.
And that's the one that's associated with Ehlers-Danlos syndrome, osteogenesis imperfecta. She doesn't have that gene.
Yes.
Now, there is a subsection of Ehlers-Danlos that has no gene, the hypermobile kind.
Yes.
Did she share with you that she had already been to geneticist Kathy Stevens in Chattanooga?
I can't recall.
Okay. Did she share with you that a different doctor, being Dr. Kathy Stevens, had not diagnosed her with EDS?
I honestly can't recall.
Okay. Did she share with you that she scored a 2 out of 9 on a Beighton scale score for EDS?
I can't recall.
Okay. If you score a 2 out of 9, that is extremely low for that scale, isn't it?
Generally, it should be 4 to 5 or more, but there are other factors that are also involved.
Okay. Did she share with you that she was found not to have doughy skin?
I can't recall that.
Did she share with you that her scarring appeared normal?
I can't recall, yeah.
Would you agree as a geneticist, if the Beighton score was 2 out of 9, the skin is not doughy, and the scarring is normal, there's really no point in testing further for Ehlers-Danlos syndrome?
It's a little bit more difficult because you must also look at other things, because as people get older, they are not so flexible. And if those 5 basic points for the Beighton score is not testing positive and you're suspicious, you have to look at the other joints like the shoulder, hip, ankles, and toes. And then the other family, other personal, other history will also be there, like history of maybe heavy cycles, maybe there are several other criteria you have to go through basically, because as you get older, if you're not having enough criteria, you must look at the others.
Okay. Would you agree as a geneticist that it is impossible to diagnose a baby or an infant with EDS right now?
Well, if you do the genetic testing and the gene changes are what is known as pathogenic, then it's
Okay.
easier. Yeah.
But there's no pathogenic gene testing positive for Jameson for EDS.
Not as yet.
Okay. You also did the genetic testing on Brady Timms.
Father?
Yes, on the
Yes,
father.
yes.
And he had the qual 1A2 variable of unknown significance. You never diagnosed the father with osteogenesis imperfecta.
He had history of fractures.
But his fractures was from a motorcycle accident, more as a late teen adult.
I saw only the child.
As Brady Timms, the father, his fracture was from a motorcycle
Yeah.
accident. Lots of people break in motorcycle accidents.
Possible.
Lots of people without osteogenesis imperfecta break in motorcycle accidents.
Yes, possible.
That factor alone does not mean he has osteogenesis imperfecta.
No.
In fact, you found that he had no history of breaks as an infant.
He started breaking when he was in his high school years, I think.
In a motorcycle accident.
It was something else also. He was an athlete.
An athlete?
Yeah.
So an athletic event broke his bone?
To my understanding.
Okay. But you never diagnosed him with osteogenesis imperfecta?
I didn't see him professionally for that.
Okay. In fact, when I talked to you, you said the only way to do any further testing on him would be to do a biopsy, and it's very invasive.
Well, it is invasive, it is time consuming, and it's simple to order a test, but between collecting the skin, culturing the cells, it takes several weeks, and then sending it off to the Seattle lab. Between the first and the end of it, there can be many things that can go wrong.
Okay. When you had the GenDx reanalyzed, you said you were allowed to have it reanalyzed. You got the results back. The qual 1A2 gene was still showing unknown variable of unknown significance.
Yes.
And just for clarification, the categories it could have been is pathogenic, likely pathogenic, variable of unknown significance, likely benign, or benign.
Yes.
That's the classifications you look
Yes.
for. So in the additional time frame that had went by, the lab has not reclassified that.
I have to reach out to the lab and ask them, but generally I did it a couple of months ago. They haven't reclassified, and then I can ask maybe in a year's time.
Okay. And when you did the analysis, it was very likely not to ever be pathogenic. Isn't that correct?
Difficult to say. Again, I would have to do the skin biopsy and do further testing and further research.
Right. But that's what the test itself said. Not very likely to alter mRNA splicing.
And since then, I've like been to the genetic meeting, done further research, and I don't know if I can say if I've spoken to experts. I don't know, but further research needs to be done. And like I said, it's difficult and invasive.
Okay. You also said you noted a microdeletion on the long arm of chromosome 15 at 15q11.2.
Yes.
That is not to be a factor in this particular case because it would not have caused broken bones.
No, but it causes developmental delay, and we have to watch the child as he grows up.
So this would not be a cause of the broken bones in this case, is my point.
No.
Okay. Jameson continued to meet all his milestones every time he came to
Okay.
your office. That's one of the things you checked.
Yes.
You also had the bone density scan done on Jameson.
Yes.
Came back normal.
Very difficult because I tried to do it, but the child is less than 4 years of age. Child shouldn't move. And I don't know if I can say if I spoke to the specialist, but research says that you should repeat it later again because there's very little data on DEXA bone scan of children at that age.
But the scan itself came within normal limits.
I think so, yes. Can I don't know if I'm
Absolutely,
allowed to
yeah.
look. I can't remember. I didn't give much information, so basically I have to repeat the testing again at some point. I don't know if I brought that test result. I think I brought only the genetic test results. I would have to go back and look at it again. Yeah, I brought only the genetic test results.
Okay. The fact that the bone density test came back normal, that would be an indicator that he is a normal little boy, though, isn't that correct?
I would have to look at the results to look at it further. I don't think, as I recall, it didn't give much information. Unless one of you have
May I
it.
approach the witness?
You can.
That's the bone density test that
thank you.
ordered on Jameson.
Yes, and I had done research on this, and the basic thing is that we have to have more information on bone density on children of this age before we can conclusively say yes or no.
But the lab itself said it was within normal limits.
But I'm not the, how shall I say, I'm not the radiologist to give the final say on this.
But that's what the test said.
I had, how shall I say, discussed with experts, and they are not sure themselves. So they asked me to repeat it again. I don't know if I can say that.
In addition to having the bone density test done, you also did a more extensive gene panel test on Jameson, the 67 panel test.
67 panel test, I think, was by in vitro. I had done the whole exome sequencing.
NVIDIA test?
No, I didn't do that. They already came to me with the test results.
So someone else ordered it?
Yes.
And you analyzed it?
I looked at it, yep.
Okay. And in that, again, the only variant that would be even a potential issue is the Qual 1A2, and that particular test also says that that is not known to be pathogenic at that time.
Yes, but in my further research, we need to do further testing.
Okay. At the end of the NVIDIA test, there is a guide on how to interpret the VUS.
Yes,
Did you read the guide when you read the test?
yes.
Specifically as to what the results mean for you, it says no significant genetic changes. That would be pathogenic variants or mutations were found in your genetic test.
Yes,
However, your test did find a genetic change called a variant of uncertain significance
yes.
in one or more of the genes tested.
Pardon?
That's what it said.
Yes.
When we see a genetic change but are unsure of its impact on health, it's called a variant of uncertain significance.
Yes.
Right now, there is not enough information about the VUS to know whether it causes disease or not.
Yes,
A VUS is a common type of result.
yes,
We all have many genetic changes that do not cause medical problems.
yes,
And most of the time, we later learn that a VUS is not related to disease risk.
yes,
So the test itself says more times than not, it comes back that the variable of unknown significance is not even a factor at all.
yes,
And in this particular case, it's unlikely to cause problems because the variant he has is for the receptor on the mNRA. And
Splicing
because of that splicing, it's probably not ever going to cause any problem in his whole life.
I can't say that, unfortunately, because as I said, since my further research, I've been advised by experts, or I've done research and think that we should do further testing on this family, and the experts will help us look at the skin biopsy, although it is very difficult to do, and they will look further to see whether this spelling mistake actually affects the splicing function.
As part of the records that you collected in this case, you collected the bone scans, like the x-rays, the skeletal
Yes.
surveys, these surveys of the head.
Whatever was from children's, yeah.
Okay. In addition, you got the rereads that were done at Texas Children's Hospital, didn't
Yes.
you? And why were you collecting the rereads in addition to the original children's healthcare scans?
I thought that the Texas person had done a second opinion, and I wanted to see I just collect the results to see.
Okay. And the second opinion stated that O.C.G.A read the scans correctly, didn't it?
Yes,
So there was, in fact, 3 broken ribs and a
Yes.
compression fracture.
yes,
And then you also got the second opinion on the Erlanger scans from November of 2021, didn't you?
yes,
And the second opinion there said there are no breaks at all.
yes.
In no scans, in none of the readings, did you find any evidence of metabolic bone disease?
I cannot comment on that. I can only go by whatever report is there because I'm not unfortunately.
Okay.
I'm
They
not a
didn't report
radiologist.
metabolic bone disease?
Yes.
Okay. Specifically, even as to his head, the head exams came back normal.
Yes,
Okay. Would you agree that it's better to have an X-ray or a skeletal scan read by a pediatric radiologist?
yes.
Why is it more important to have them read by a pediatric radiologist?
Because they would know the variabilities in the children compared to adults.
Okay. Is there more training that goes into a pediatric radiologist than just a general doctor
Yes.
or a radiologist?
Yes,
Okay. Do you find it helpful to look at the reports from the pediatric radiologist in the cases that you
Yes.
study?
yes.
Okay. You had a couple errors in your own report, didn't you?
Yeah, I don't type very well, and I talk into a system, and it doesn't always put the right thing.
One of the errors you made was you said that Jameson had bulimia.
No, it's not bulimia. With
Yeah.
my accent and the typing thing, it goes way off sometimes.
Yeah. Bulimia is like when a high school girl's throwing
Yeah,
up.
No,
Yeah.
not at 4 months.
Yeah. You also sent the vitamin D test on the wrong child as part of your report.
I don't know.
I won't say the child's name because I'm sure HIPAA protects
Oh, show me.
this little girl. But the report that you sent is for a 6-year-old little girl.
Oh, what happens is this, when the system comes in through the faxes sometimes, my staff, when they put it in automatically one after the other, it goes into the wrong chart.
So the vitamin D deficiency that was served on the state is actually from a 6-year-old little girl.
This is a different patient, yeah.
Jameson's vitamin D was normal, wasn't it?
Yes,
And in fact, you looked at it and confirmed that through O.C.G.A's records as well.
yes.
You indicated that you had done a great bit of research in this case. My first question would be, are you familiar with the article Hypermobile Ehlers-Danlos Syndrome, also known as Ehlers-Danlos Syndrome Type 3 and Ehlers-Danlos Syndrome Hypermobility Type?
Yes.
That was authored by Brad Tinkle and Marco Castori, isn't it?
There are many articles. I looked at the articles from Gene Reviews.
May I approach the witness?
You can.
Is this one of the articles that you reviewed?
No, I didn't look at this article. I look at the articles on other articles on PubMed and on Gene Reviews. Gene Reviews is a website all geneticists go to, and we look at articles from that.
Well, I've got a few more, so let me see if I can get one that you've actually looked at. That particular article you had not.
No.
Okay. Are you familiar with the article Genetic Differentials of Child Abuse? Is your case rare or real?
On PubMed, there's many articles you can go to. I may not have looked at that article. I would have looked at some other article, and I didn't print those.
Did you look at that article?
No, not this one.
Are you familiar with the article Fracture Prevalence in Children Diagnosed with Ehlers-Danlos Syndrome and Generalized Joint Hypermobility?
Again, I wouldn't look at this specific article. I would have looked at other articles in PubMed. And I don't print those out. I read through it and then I just take the information.
Did you read this particular article called Fracture Incidence in Ehlers-Danlos Syndrome, a Population-Based Control Study?
Again, the same answer. I would have looked through many things. I would not necessarily print everything out.
Is it a fair assessment that in your research that hypermobility EDS does not have broken bones as a factor for determination? There are other kinds of EDS, but hypermobile specifically does not. It's not diagnostic.
Okay, from my personal experience, when I've seen many patients with hypermobile EDS, they come to me with history of dislocations and very often fractures.
Okay. In addition to doing the research, you claim that the research that you did, but you don't have any of those articles.
I didn't print all the articles out.
Okay. In addition to the research that you did, would you agree in this particular case that you did not diagnose Jameson with osteogenesis imperfecta?
He's difficult to say at this point because he's got a variant of unknown significance and we have to follow up with the lab in the future for test results and clinically also follow him up in the future.
Well, I asked you specifically last week, and you said as of right now, you have not diagnosed him with osteogenesis imperfecta.
Yeah. We cannot, we have to follow up with the lab.
So as we're sitting here today, on March 31st of 2025, you have not diagnosed him.
It's like some of the genetic conditions, you don't have the gene yet, but you kind of look at the family history and you think, this is odd. And you think, okay, there's a variant of unknown significance, we have to follow up. Black and white, you cannot diagnose yet, but suspicious.
Suspicious.
Yeah.
But you have made no diagnosis.
As yet, you clinically cannot.
Okay. You also told me you have not diagnosed him with Ehlers-Danlos syndrome.
As of this point, I cannot because he's young. I have to follow him up as he grows up.
You didn't diagnose him with Cole-Carpenter syndrome.
No, not that I recall.
Okay. In this particular situation, you've actually seen Jameson off and on for about 3 years?
Yes.
Okay. I'm not going to tender this. I just want to make sure we're talking about the same child. I'm going to show you what I marked.
What the
as
future
stage
looks
12.
like. Yes.
Is that the child you've
Uh-huh.
been seeing? That's the child you've been seeing? I'm not going to tender it yet. You can set it down right now. But that particular child has beautiful pearly white teeth.
You would have to look in close up, in real person, to look at the teeth. The picture is not very clear.
Okay. And when you looked at Jameson close up, you've never noted that he has poor dental teeth?
Dental teeth and all, you got to follow up as a child grows up, and the dental hygiene and all that kind of thing.
And in this particular case, Jameson has had no additional breaks while he's been in the care of his family?
Not to my knowledge.
He's had no unusual bruising when he's been in the care of his grandparents and his aunt and uncle?
Not that I got family history of.
If he had additional breaks or if he had additional bruising, that would have been important to you as his geneticist?
Yes.
And I asked you this specifically last week, and you told me that as you sit here today, you cannot say that Jameson was not physically abused.
Physical abuse can occur in children with and without EDS.
So what you're saying is a child with EDS can be physically abused?
Yes.
A child with osteogenesis imperfecta can be physically abused?
Yes.
And after reviewing Jameson's medical records, you cannot say he was not physically abused. You told me you were neutral. You can't
I'm
say it's
neutral.
physical
One way or
abuse.
the other, I can't
You can't
say.
say he has a genetic
Yes.
thing. You're just sitting here in the middle, neutral.
Yes.
So if somebody said you were going to take the stand and say he had not been physically abused, that's false.
Difficult to say because one way or the other, you can't tell.
No further questions, Your Honor.
Good morning, Dr. Krishnamurthy.
Good morning.
Have you ever testified in court before?
Yes, once before here.
So this is the second time you've testified in court. Okay. And you first saw Jameson in February of 2022, right?
Yes.
Okay. Did anyone from the state call you to talk about the report that you made?
That I made.
Yes.
I think I've spoken to Ms. Fox before.
And when did you speak to Ms. Fox?
I think I've spoken twice to her. The most recent was several days ago.
And do you remember when the first time was?
I think if I'm correct, some time back. Because the 3-4 different cases, you get confused at times. But definitely I spoke to her recently.
Do you remember if you spoke to anyone from the state before March 14th, 2022?
I can't recall that far back, yeah.
Okay. And so you have seen Jameson in your clinic 3 times, is that right?
Yes,
And each time was he was accompanied by his family members?
yes.
And was there ever anybody from the Department of Family and Children's Services with them?
Not that I can recall.
So were you able to observe the dynamic among the family members and the interactions with Jameson?
Yes,
And did you notice anything about those interactions that was concerning or negative to you?
no,
And you are, as a pediatrician, you are a mandated reporter, right?
yes, of course.
So if you see any evidence of child abuse, then you're required to report that to the Department of Human Services, right?
Yes, yes,
And so if you had seen any evidence of abuse being perpetrated on Jameson Timms, would you have reported it
yes,
as you are required to do?
yes.
But you didn't see any of that
No.
evidence. And in your practice, have you treated children who were abused and subjected to inflicted trauma?
Yes,
So you have seen that before?
yes,
And you have reported that before?
yes.
But you did not do that in the case of Jameson Timms?
No, the family interaction was normal.
And did you see anything in Jameson's test results that suggested other kinds of injuries, like head injuries or hemorrhaging or other suspicious factors?
No,
And you said that throughout the time that you have treated Jameson, you did not see any additional broken bones or fractures or anything like that, right?
Yes.
All right, so let's talk a little bit about your visits with Jameson.
Okay.
So your first visit with Jameson in February of 2022, what do you recall about his physical condition at the time?
I recall the light blue sclera,
Okay.
the soft doughy skin.
And the sclera, that's the part of
The
your
white-
eye that's
the white
usually,
of the eyes,
so that it's usually supposed to be white.
most
But-
of the times.
But when you saw Jameson in February, it was light blue?
Yes.
And how about when you visited with Jameson in 2020, in May and August of 2024? Was that still the case for him, or had it changed?
I think still the case.
Okay. So even when you were seeing him as a 3-year-old, he still showed the light blue sclera?
Yes.
And you mentioned doughy skin. Can you describe that for the jury? Why that would be important, what you're looking for, and what Jameson's skin looked like to you?
Soft. Very nice to the touch. It's not firm.
Okay. And would you expect it to be firm when you are doing an exam?
Generally,
So that was an unusual finding?
when I see soft doughy skin, I think of two things. One, I think of either connective tissue disorder. I think of low muscle tone.
And did you do any additional testing or observation to see if low muscle tone was an issue with Jameson?
No, his milestones were normal at that point.
Okay.
I mean, he was doing all the things a 4-month-old should do.
So, other than the light blue sclera and the soft, doughy skin, did you observe anything else about Jameson's physical condition that was of concern to you?
I don't know if I can look at my chart.
Absolutely, you can
I
refer
can't
to your notes.
yeah,
I know this
I can't recall.
was 3 years ago.
It was some time ago. I saw the sclera that was light blue. I saw his hips were stable at the first visit. Everything else looked okay.
Okay. Did he seem to be in any great pain or distress when you
No.
observed him? Did you notice any unusual bruising or injuries or anything else
No,
on any of the times that you visited with Jameson?
No.
When you first visited with Jameson, had you already received the genetic testing results from Children's Hospital that showed the genetic variant on call 1A2
R1A2, yes.
and SP7?
Yes, the in vitro test results, yes.
And then when you visited with Jameson in May of 2024, did you observe anything about any skin rashes or skin modeling?
I think so, yes. I'm trying to recall, I think yes. Yes, he had a rash, especially when he strains. And in the history, I got the history that he has popping and cracking of joints. And grandmother reported that he says, "Ow," when the joints pop. That was the history I got at the second visit. And he has soft, doughy skin again with the blue sclera.
And did you notice or learn anything about any digestive issues?
He has constipation and abdominal pain. And he did complain of abnormal bruising at that visit.
Okay.
I mean, the family gave me the history.
And was this still the grandmother giving you the history, or was anyone else giving you that information?
I think history is mostly from the grandmother and grandfather.
Okay. Right. And then, so the May visit was when you ordered the DEXA scan that was completed in July of 2024, right?
Yes.
And a DEXA scan, let me see if I can get this right, dual emission X-ray absorbometry.
Uh-huh.
Okay, and so that's kind of like an extra strong X-ray, is that a,
No, it looks at how strong your bones are generally.
okay, so, but it does that with regular X-ray technology, just more of it?
I'm not the radiologist to say how they
Okay.
do it. Yeah.
Well, but I guess, so when you get the result from the DEXA scan, what are you measuring it against to see if it's normal or not?
Yeah, and so that's the thing. I wanted to get a baseline to see if I could get any information out of it, but not much information. And it's my understanding that I would have to repeat it in the future so that I can compare it to other children who are of the same age, who are normal, and then that would give me a better result in the future, whether yes or no, it means something.
Okay. And did the assessment on Jamison's DEXA scan come back below the mean, even though it was within normal range?
I think so, yes. But again, I'm not the radiologist to say, but
Right.
I've done research on that, and what was suggested to me was that there was not enough information, and it is good to repeat the test in the future.
And in the time that you have been working as a pediatric geneticist, have you seen gene variants change classification from unknown significance to likely pathogenic or likely benign?
Yes, yes,
Okay, so that is something that you have seen in the
Yes.
course of your practice and research?
yes.
And is that something that you have seen with the genetic variation that Jamison has on COL1A2 or SP7?
Maybe not the same specific gene change. I would have to look at all the records that I have so far for patients, but generally, I've seen the labs change their report one way or the other.
Okay. But have the labs changed their report on these particular variants in Jamison's case?
They haven't changed it yet. I mean, for this case itself or for the gene as such.
For the gene itself and for Jamison's individual case?
In Jamison's individual case, they haven't changed the thing, but for the gene as such or other genes associated with connective tissue disorders, I've had patients where the results have changed.
Okay. And now you, I believe the diagnosis on the, on your original report, the genetics report that you made, was on February 15th, 2022, systemic involvement of connective tissue unspecified.
Yeah.
So that was your initial
clinical-
diagnosis based
clinical
on,
Yes,
based on the exam and the genetic results.
yeah.
And you mentioned earlier that connective tissue is kind of like the scaffolding that holds up everything in our body.
Yes.
So if someone has an issue, even a small issue, with the way that their connective tissue is being put together, would you expect that to affect many different parts of the body, just one part of the body? What would you expect based on your experience, training, and research?
Okay, it depends, basically. This is the gene is that what are the other factors that are affecting the strength of the bone? Could there be associated copper deficiency? That's also involved in making the bone. What about vitamin C? That's also involved in making the bone. What about other things like manganese? And so there are other cofactors that we have to think about when we think of the strength of the bone or the making of the bone.
Okay. So you mentioned that vitamin C is one
Yes,
of those
yes.
factors. Is
Yes.
vitamin C involved in collagen production?
Yes.
Okay. And then you mentioned manganese as well.
One
What
of
is the impact of manganese?
I think that one of the cofactors, just like copper and vitamin D, is also important because if you have vitamin D deficiency, that can also increase the risk for fractures if you have some other cofactor that is, it's not just one thing, it's other things also that is involved.
Okay. Now, have you ever dealt with any patients that have been diagnosed with birth-related fractures?
Yes,
Okay. So is that something that you've seen before in your practice?
yes.
And have you observed anything about, I guess, cofactors might be the word for when you have observed patients who have birth-related fractures?
Like I've had several patients where when they were born, the birth was a little difficult, so the arm was fractured. Sometimes the clavicle can be fractured, things like that.
Okay. And how about any medications that the mother may be taking during pregnancy, specifically anti-nausea or blood pressure medication? Have you done any work or noticed any?
I would have to do research on that.
Okay. And you were only treating Jamison Timms as your patient,
Yes.
right? Brady Timms and Carrie Timms were not your patients. Did you have occasion to make any observations about the physical condition of my client, Carrie Timms, while you were treating her son?
Yes, she showed me her arms, which are hyperflexible.
Okay. But did you conduct a formal Beighton scale test
No.
on her?
I was seeing only the child.
But from what you observed, she did have hypermobility and more flexibility than you would expect from someone of her build and age?
Her elbows were definitely hyperflexible.
And did you have access to any vitamin D testing that was conducted on Jamison at birth or during the pregnancy for Carrie Timms?
Not that I can recall.
And I think, you know, in your discussion with Ms. Fox and Mr. Hood, we heard a lot of "it depends" and "we don't know yet." Is that fair to say that those have been your findings with regard to some of this genetic testing?
Yes,
And so you, like you said, you cannot say Jamison Timms has osteogenesis imperfecta or any other condition, right?
yes,
But you can say Jamison Timms has genetic variants on the genes responsible for creating and strengthening connective tissue, right?
yes.
Okay. And over the 3 years that you have seen and treated Jamison Timms, Have you had any concerns that his family was subjecting him to abuse or anyone in his family?
No,
Did you get the impression that this was a family that would tolerate abuse or make excuses for it in some way?
no,
Because you have had families like that,
yeah, yep,
but not this family.
No.
Thank you very much, Dr. Krishnamurthy. We appreciate your time.
Thank you, Ms. Bernard. Mr. Hood, any additional questions of your witness?
No additional questions.
Ms. Fox, any additional questions of this witness?
So much of the information you got from the family history is actually self-reported, wasn't it?
yes,
So when they say, I have hearing loss,
Yes.
if they don't explain they live near the drag strip, there's factors that you might want to know whether it's environmental or genetic.
yes,
When they say, I've had a normal, uncomplicated pregnancy, but you didn't physically look at the birth records.
no.
You're taking at the word.
Yes,
When the mom turns around and does that, says, well, I've got hyperflexible, you didn't go and do the full scale to see if there's anything else, other than the fact she can do a trick with her elbows.
she hyperextended her elbows.
Yeah, just like I just did. It doesn't mean you have a syndrome, it just means you can
Yes.
put your elbows together behind your back.
Yes.
Okay. No further questions, Your Honor.
Ms. Bernard?
Have any of these additional questions changed your assessment about the patient Jamison Timms?
No,
And is there anything concerning about Jamison Timms to you as a mandated reporter that you haven't told us about already?
no,
Thank you very much, Dr. Krishnamurthy.
Anything else from anyone else of this witness? May she be excused.
No objection.
Doctor, thank you for coming.
Thank you.
You're free to go.
Okay.